Hi everybody, and welcome to our module on lipid metabolism. Lipids are compounds that are made up mostly of carbon and hydrogen, and because they are made up mostly of carbon and hydrogen, they are nonpolar, and therefore they are not soluble in water. So as we will see, the body has systems in place in order to transport these structures around the body, which are not soluble in the bloodstream, which is made up mostly of water. And there are many types of molecules that fall under the heading of lipids. Some of the most important ones are fatty acids and triglycerides and cholesterol, but also many other substances like phospholipids and steroids and glycolipids. In this module, we're going to talk a lot about the transport of triglycerides and cholesterol. So let's start by talking about what molecules of triglyceride and cholesterol look like. On the top left of the screen here is the structure of a fatty acid. It ends in a COOH group, but mostly it is a very long chain of carbons and hydrogens. On the top right is the structure of a molecule of glycerol. If you add 3 fatty acids to a molecule of glycerol, you get a structure called a triglyceride, which can also be called a triacylglycerol molecule. It's got a glycerol molecule with 3 acyl bonds connecting it to 3 different fatty acids. And triglycerides are one of the very important lipids that we're going to talk about in this module today. The other important lipid molecule we're going to discuss in this module is cholesterol. This is the structure of cholesterol on the screen here. Notice that it looks very different from a fatty acid or a triglyceride molecule. Notice also that it's composed mostly of carbons and hydrogens, so therefore it's not soluble in water. It's going to be a lipid. Also notice that it's got these several rings connected together here, which is something you don't see in fatty acids and triglyceride structures. Because lipids are not soluble in water, they are packaged into structures called lipoproteins so that they can be transported in the plasma, which, as you know, is made up mostly of water. Lipoproteins are particles of lipids and proteins, and they're used to transport lipids from one place to another through the bloodstream. And there are many different types of lipoproteins. We'll talk about all of these in this module. They include chylomicrons, very low density lipoproteins, intermediate density lipoproteins, and then finally the low density lipoproteins and the high density lipoproteins. The different types of lipoproteins vary in both their size and their density. So the chylomicrons are the largest lipoproteins and the HDL particles are the smallest. On the other hand, in terms of density, the HDL particles are the most dense. That's why they're called high density lipoproteins. And chylomicrons are the least dense of all the lipoproteins. Apolipoproteins are proteins that can bind to lipids, and they're found in the lipoprotein particles, and they serve various functions that we'll talk about in this module, including functioning as surface receptors so that those lipoproteins will be taken up by cells, and also as cofactors for certain enzymes. So now that we've defined some of the important terms related to lipid metabolism, let's start our discussion of lipid metabolism by talking about how different lipids are absorbed. And we'll begin by talking about how fatty acids are absorbed from the GI tract. In the GI tract, fatty acids are converted into triglycerides by combining them with glycerol molecules like I showed you a few slides ago. The triglycerides are then packaged into lipoprotein particles called chylomicrons by the intestinal cells. The chylomicrons are then secreted into the lymph, and from the lymph they go to the bloodstream. And this is how fatty acids get from the gut into the bloodstream in the setting of chylomicrons. The absorption of cholesterol is a little bit different from the absorption of triglycerides. Cholesterol is converted into structures called cholesterol esters. I'll show you a picture of those in a minute. These are formed inside of enterocytes in the gut. There is an enzyme in the gut called acyl-CoA cholesterol acyltransferase, or ACAT, and this can convert cholesterol into cholesterol esters. The cholesterol esters are then packaged into chylomicrons together with the triglycerides we talked about on the last slide, and then these go to the lymph and then finally to the bloodstream. So if you take a cholesterol molecule and you add a fatty acid to this hydroxyl group here, you will get a structure called a cholesterol ester. It's a combination of a cholesterol molecule and a fatty acid. And that enzyme ACAT that I mentioned inside of enterocytes can convert cholesterol and fatty acids into cholesterol esters. And the body likes to do this because cholesterol esters are a more efficient way to package and transport cholesterol and fatty acids. They can be tightly packed together so that more of these structures can be carried inside of lipoproteins. So chylomicrons, therefore, are lipoprotein particles that are synthesized in enterocytes, and they're used to transport triglycerides and cholesterol into the plasma once you consume those structures in meals. So inside of chylomicrons, you can find triglycerides and cholesterol in the form of cholesterol esters. You can also find fat-soluble vitamins like A, D, E, and K, and they will all be packaged together in a chylomicron and sent to the lymph, and from the lymph they can get to the bloodstream. There's a very important apolipoprotein found on chylomicrons called apolipoprotein B48. This apolipoprotein is unique to chylomicrons. It's only found on chylomicrons, and it gets its name because it contains 48% of the ApoB protein. As we will see later, there is another apolipoprotein called B100 that contains 100% of the ApoB protein. And the most important thing to know about B48 is that it is required for the secretion of chylomicrons from enterocytes. There is a rare disorder that we'll discuss later in this module where children are born unable to assemble chylomicrons with B48. As a result, they cannot release the chylomicrons from their enterocytes. This means that lipids accumulate in the GI tract and these children are unable to absorb fat-soluble vitamins. Once chylomicrons begin to circulate in the plasma, they will encounter an enzyme called lipoprotein lipase, or LPL. This is an extracellular enzyme that is anchored to capillary walls, and it's found mostly in adipose tissue and the muscle and the heart. Importantly, it is not found in the liver. The liver has its own lipase called hepatic lipase. What lipoprotein lipase does is it converts the triglycerides inside of chylomicrons into fatty acids and glycerol, and then the fatty acids can be removed and used for storage in adipose tissue or fuel in the muscle and heart. So lipoprotein lipase will shrink the chylomicrons by removing the fatty acids from triglycerides. And importantly, lipoprotein lipase requires an apolipoprotein called ApoC2 for activation. This apolipoprotein is carried on chylomicron particles so that lipoprotein lipase can get activated. This slide depicts the important apolipoproteins for chylomicrons. As we talked about before, B48 is necessary so that chylomicrons can be secreted from enterocytes. C2 is an important apolipoprotein because chylomicrons need it as a cofactor for lipoprotein lipase. It's found on chylomicrons and also on VLDL and IDL, which we'll talk about in a few slides. Another important apolipoprotein for chylomicrons is ApoE. This apolipoprotein binds to liver receptors, and it's necessary so that chylomicron remnants can be taken up by the liver after they've gone through the circulation and done their job. And you should know that both C2 and ApoE come from HDL. One of HDL's jobs is to donate these two particles to other lipoproteins, and in fact, it gives C2 to chylomicrons as well as ApoE. So let's review what happens to chylomicrons as they move through the circulation. They're secreted from enterocytes with B48, and then they pick up ApoE and C2 from HDL. As they pass by skeletal muscle and adipocytes, they encounter lipoprotein lipase, and then they give up the free fatty acids contained in their triglyceride molecules. They then will become what's called a chylomicron remnant, and this will go to the liver, where the liver has receptors for ApoE. A word on those chylomicron remnants. They have ApoE on their surface, and this is necessary because there are ApoE receptors on the liver, and the liver takes up the remnant particles by receptor-mediated endocytosis. Chylomicrons are only present after you eat a meal. When you eat a meal rich in triglycerides or fatty acids, the amount of chylomicrons in your plasma increases, but then they clear about 1 to 5 hours later as all the triglycerides are hydrolyzed and as the remnants are taken up by the liver. If you draw the blood of someone who's just eaten a fatty meal, you will see a milky appearance to the plasma, and that's because of all those chylomicrons that are present carrying the triglycerides and fatty acids. So here's a summary of the important points to remember about chylomicrons. They are secreted from enterocytes with ApoB48 on their surface. They pick up ApoC2 and ApoE from HDL. They carry triglycerides and cholesterol esters, and they deliver the triglycerides to cells. Remember that lipoprotein lipase stimulates the breakdown of triglycerides using ApoC2 as a cofactor. And then finally, they return to the liver as chylomicron remnants. In the liver, there are ApoE receptors that recognize the chylomicron remnants and take them up by receptor-mediated endocytosis. So you can think of chylomicrons as shuttles that carry lipid particles from the GI tract to the tissues in the liver. But now we're going to talk about how the liver sends out lipids to tissues that may need them. And we're going to start by talking about cholesterol synthesis. And you should know that only the liver can synthesize cholesterol. The liver can start with molecules of acetyl-CoA and acidoacetyl-CoA and synthesize HMG-CoA. HMG-CoA stands for 3-hydroxy-3-methylglutarol coenzyme A, but that's a big word, and most people just call it HMG-CoA. It's synthesized by an enzyme called HMG-CoA synthase. There's another enzyme in the liver called HMG-CoA reductase, which can convert HMG-CoA into mevalonate. This is the structure of mevalonate. And then through a series of steps, mevalonate can be converted into cholesterol. The reason HMG-CoA reductase is such an important enzyme, and the reason I've bolded it here, is because statins inhibit this enzyme, and this is part of the mechanism by which they can reduce the levels of LDL cholesterol. The liver secretes two main lipoproteins to deliver cholesterol and triglycerides to tissues in the body, and those two lipoproteins are VLDL and HDL. HDL is referred to as a scavenger lipoprotein, and this is because it can pick up cholesterol in the periphery and bring it back to the liver. This is sometimes called reverse transport of cholesterol back to the liver. You may know that high levels of HDL are associated with a lower risk of cardiovascular disease. Some people remember that the H in HDL stands for healthy. One of the reasons that HDL is good for you is because of this scavenger role. It can pick up cholesterol and bring it back to the liver so that that cholesterol is not available to become part of an atherosclerotic plaque. HDL is secreted as small HDL particles called nascent HDL particles. These particles develop into mature HDL particles that contain certain apolipoproteins, including A1, C2, and ApoE. We'll talk about what A1 does on the next slide, and we talked about before how ApoE and C2 are donated to other lipoproteins like chylomicrons and VLDL. HDL carries an enzyme called lecithin cholesterol acyltransferase, or LCAT, and what LCAT does is it takes the cholesterol that HDL picks up from the tissues and it esterifies it. We talked earlier in this module about how cholesterol can be esterified to fatty acids. LCAT will do that for the cholesterol that HDL picks up, and then those esters can be packed densely into the core, allowing HDL to carry a lot of lipids and cholesterol in a small amount of space. The reason that HDL carries the apolipoprotein A1 is because A1 is necessary for the activation of LCAT. Another important molecule found in HDL is called cholesterol ester transfer protein, or CETP. This protein exchanges the esters in HDL for triglycerides in VLDL. It allows HDL to take some of the triglycerides from VLDL particles and give them in return those esters, which can be more densely packed into the core, and this relieves some of the bulky triglycerides that VLDL particles are carrying around. Then the cholesterol and the triglycerides that HDL has picked up, it carries back to the liver. In contrast to HDL, which is a scavenger lipoprotein, VLDL is a transport lipoprotein. Its job is to carry triglycerides and cholesterol to tissues that need them. It's secreted by the liver as nascent VLDL particles that contain only apolipoprotein B100 on their surface. Then these particles will pick up from HDL, C2, and ApoE, just like chylomicrons picked up these two particles from HDL. When VLDL is secreted from the liver, it contains lots of triglycerides. I've shown that in this picture on the screen. There's lots of red inside this molecule to indicate the large amount of triglycerides in VLDL initially. However, the content of the VLDL particles changes during circulation. VLDL particles will encounter lipoprotein lipase just like chylomicrons encountered lipoprotein lipase, and that enzyme will remove some of the triglycerides. In addition, as we talked about before, the CETP protein in HDL will remove triglycerides from VLDL in exchange for cholesterol esters. So I've shown that process here. The LPL and the CETP will remove triglycerides. As a result, as VLDL moves through the circulation, it loses lots of its triglycerides and it then becomes an IDL particle. So IDLs, or intermediate density lipoproteins, are formed from VLDLs. Once they are formed, two things happen to IDLs to turn them into LDL particles. The first is that IDLs encounter hepatic lipase, which removes triglycerides. In addition, HDL takes back C2 and ApoE from IDL. This leaves an LDL particle which has only one apolipoprotein, that's B100. In addition, it has much less triglyceride content compared to IDLs and a far greater cholesterol content compared to IDLs. And then just a note here, because C2 and ApoE are taken by HDL, some sources will say that IDLs do not contain C2 or ApoE. Others will say that they do. The most important thing is that at some point the IDL particles lose C2 and ApoE and that those are not found on LDL particles. A word about hepatic lipase. It's found in liver capillaries and it has a similar function to lipoprotein lipase. It causes the release of fatty acids. It's very important for the conversion of IDL particles into LDL, and we know this because in lab animals who do not have hepatic lipase, they are unable to convert IDL into LDL. So now let's talk about LDL, or low density lipoproteins. These lipoproteins have a small amount of triglycerides but a high concentration of cholesterol and cholesterol esters. Their job is to transfer cholesterol to cells with LDL receptors. Cells that contain LDL receptors can take up LDL particles, by receptor-mediated endocytosis. And the LDL receptors recognize B100, and B100 is the apolipoprotein found on LDL particles. You may know that high levels of LDL cholesterol are associated with increased risk of cardiovascular disease, and part of the reason for this is because of the high concentration of cholesterol inside of LDL particles. That cholesterol can be donated to vessel walls and become atherosclerotic plaque. Foam cells are macrophages filled with cholesterol, and you can find them in atherosclerotic plaques of the blood vessels of patients who have vascular disease. And foam cells contain LDL receptors, and they consume LDL particles, and that's how they fill with cholesterol and develop into the plaques inside of vessel walls. So here's a summary slide of the lipid metabolism we've been discussing. HDL is secreted from the liver. It contains ApoA1 and ApoC2 and ApoE. VLDL is secreted from the liver with B100, and then it picks up C2 and ApoE from HDL. When VLDL encounters lipoprotein lipase and CETP, it releases some of its triglycerides and free fatty acids. It then becomes IDL, which will encounter hepatic lipase and release more free fatty acids and triglycerides. You'll be left with LDL, which can donate cholesterol to tissues and ultimately can be taken up by the liver, which contains LDL receptors. This is a slide showing the relative percentages of triglyceride and cholesterol in the different lipoproteins. Chylomicrons, which are only present after a meal, contain lots of triglycerides. VLDL particles, which are always present, also contain lots of triglycerides. And when you take a fasting blood sample from a patient and you measure their triglyceride level, most of those triglycerides come from VLDL. LDL particles, on the other hand, contain lots of cholesterol. Remember, their job is to transport cholesterol to tissue. And then finally, HDL particles contain more cholesterol than triglycerides. Mostly HDL particles are made up of other proteins that they carry around, including the apolipoproteins we talked about that they donate to chylomicrons and VLDL particles. You may have heard of something called lipoprotein little a. It's often called LP little a. This is a modified form of LDL particles. It contains a large glycoprotein called apolipoprotein A. And elevated levels of lipoprotein little a have been associated with increased risk of cardiovascular disease. This is not a routinely measured lipoprotein, and there are no proven therapies for high levels, but you should be aware that this is often used as a marker of risk for cardiovascular disease. Our final topic in this module is a rare disorder of lipid metabolism called A-beta lipoproteinemia. This disorder gets its name because children born with this condition lack the beta lipoproteins like B48 and B100. This is an autosomal recessive disorder, and the underlying cause is a defect in something called MTP. MTP stands for the microsomal triglyceride transfer protein, and MTP's job is to form and secrete lipoproteins with ApoB, like B48 and B100. This is a very rare disorder, but the reason it comes up sometimes on the USMLE exam is because they use it to test whether or not you understand what the lipid particles with B48 and B100 do. When those lipid particles are missing, that will result in the characteristic features of this disorder. So for example, when chylomicrons cannot be secreted from the intestine due to lack of B48, lipids will accumulate in the intestines and lipid-soluble vitamins cannot be absorbed, and that's a cardinal feature of this disorder. In addition, when VLDL cannot be secreted from the liver due to lack of B100, there will be very low levels of VLDL, IDL, and LDL seen in the plasma. The condition presents in infancy with steatorrhea, which is malabsorption of fat, also abdominal distension and failure to thrive. You can see deficiencies of fat-soluble vitamins. Deficiencies of vitamin E are particularly common. This can manifest as ataxia and weakness in the baby, and also hemolysis, which we'll talk about in the next slide. There are also sometimes deficiencies of vitamin A that occur, and this results in poor vision in the baby. On biopsies, what you see is accumulation of lipids inside of enterocytes, because remember, enterocytes accumulate lipids and then secrete them in chylomicrons, but in this disorder, they cannot secrete the chylomicrons. For step one, they will want you to know the impact of this condition on the levels of the various lipoproteins. The levels of VLDL, IDL, and LDL will be low or zero because you cannot secrete VLDL from the liver, and then VLDL becomes IDL and IDL becomes LDL. If you measure total plasma triglyceride levels, those will be low because much of your plasma triglycerides comes from VLDL particles. Total cholesterol levels will also be low because much of your total cholesterol comes from LDL particles. As I said before, fat-soluble vitamin deficiencies can develop, and you may see low vitamin E levels in patients with this condition. And then finally, on a peripheral blood smear, you may see acanthocyte. This picture on the screen shows acanthocytosis. Acanthocytes are red cells with these spikes in their membrane, and this occurs when there are abnormal red blood cell membrane lipids, and that happens among children who have A-beta lipoproteinemia. And that concludes our module on lipid metabolism.